Hey guys, my name is Kelly Reed and I am a physical therapist and I specialize in oncology and lymphedema. Today we're going to talk about Kinesiotape and how you can use it to help manage your lymphedema. So how does Kinesiotape work for lymphedema? Well, when the tape is placed, it can help create a negative pressure in the system. And what that means is when the tape is against the skin, it will gently lift it up away from the tissues below, which allows space in between so fluid can move to the lymphatic vessels and then remove from that part of the body or the limb. Also, if applied correctly, it can assist with muscle activation, which creates a muscle pump, helping fluid move through the lymphatic vessels as well. The tape can also help reduce pain, fibrosis, and improve overall circulation. Before using Kinesiotape, you want to make sure you talk to your certified lymphedema therapist to make sure that it's safe for you to use. Things that we absolutely don't use Kinesiotape over include cancer tumors, infection, open sores or open wounds, and blood clots. Other things that we take high precaution for when using Kinesiotape include diabetes, because sometimes sensation has changed, or neuropathy. We also avoid if someone has a fracture in the area, or someone is allergic or sensitive to adhesives. We also want to take precaution around any heart or kidney issues, as we may not want more swelling or more fluid moving to those areas. A couple other things you want to know before you start using Kinesiotape. You want to make sure that you avoid putting it over any scrapes, burns, or sunburns, or thin skin that may tear. You always want to try a test area first to part of your skin to see how your skin reacts as well. Your skin should be free from any oils or lotions so the tape sticks well. Although the tape is waterproof, you may want to avoid excessive sweating or swimming or any showers about 1 hour after applying the tape so the adhesives have enough time to activate. The tape can stay on for up to 5 days as long as your skin tolerates it well. If you need to remove, you want to make sure that you're very gentle when pulling the tape off, and I encourage to use baby oil or some other lotion to help moisturize the tape so it comes off a little bit easier. What we're trying to do is direct the lymphatic fluid to an area that's not affected or not congested by lymphedema or fluid. So the question is it effective? Although there is not a whole lot of research done yet, there are some small studies that show that it is effective for those who have mild, either stage 1 or maybe even mild stage 2 lymphedema. For later stage 2 or stage 3 lymphedema, it is likely not as effective as CDT or your compression garments. However, you may be able to use it in conjunction with your compression garments and place on the areas like the abdominal area or the chest wall that you may not be able to have compression on. So first I'm going to show how to put Kinesiotape on for those who have lymphedema in the arm. So when putting on Kinesiotape, we want to think about the same pattern that we would do our manual lymph drainage with. Our lymph nodes are in the axillary or armpit area, and the vessels run down the arm. And so what our goal is, if the lymphedema is in the arm, we want to get the fluid moving back through to here. Now, if you've had lymph nodes removed for secondary lymphedema, perhaps after breast cancer surgery, these lymph nodes may be compromised due to the biopsies or lymph node removal. So the concept is that we want to try to get this fluid in this region or into this arm across the body into the other armpit that may not be affected, or if this area is also affected from surgery, then we want to think about going down to the groin area where the lymph nodes are. So we're going to place the tape along the arm and across the body, or even across the upper back or down the side as well. So we have our roll of Kinesiotape. What we want to do is measure out the lengths that we're going to need. So when we're doing Kinesiotape, because there is a very, very light stretch, we want to keep the length of it pretty close to the length of your arm. And what I would recommend doing is doing 2 or 3 different sets. So one being the upper arm, the second being the forearm, and maybe a third for the hand. You can combo the forearm into the hand as well, perhaps those who don't have a lot of swelling in their hand. The other pieces that we want to make are one for across the chest, or at least to the middle where your anastomosis is, so the fluid can move from one side to the other, or along your back for the same length. So I'm going to go ahead and cut my pieces now. Okay, so I actually made two pieces about the same length. So two for the upper arm and two for the forearm, and I'll show you why in a minute, and then one for across. What you want to do next is you want to make sure that we round the edges. So I'm going to cut a little bit of a circle around so that the ends don't peel up as easy. Okay, so now for each of them I curved out, or I cut out a circle or a half circle for one side. The other side I have not done, because what we want to do next is we want to cut these pieces into four to almost make a little bit of a spider web or a fan look. So I'll do one at a time. I'm going to cut once directly down the middle, and then I'm going to cut that again in half for each of them. So there'll be 4 strips that are equal. And we want to cut that all the way to about 1 inch, 1.5 inches at the top. We don't want to cut that last piece because we need an anchor. So I'm going to go ahead and do that now. Okay, so I have cut all my pieces, curving out the long end, leaving it about 1 inch or so, 1.5 inches at the end for an anchor, and then separating these or cutting these into 4 equal lengths, as well as rounding out the edges on the other end too. So now we're going to apply it. What we want to do is I'm going to start from the arm. You can start from the forearm, you can start wherever you want, but what I'm going to have you do is take, for each two, you want one starting more from the front and one starting more from the back. And what you're going to do is you're going to allow it to cross over the arm in the front and then over the arm in the back. If you have a specific area that's really stubborn, full of fluid, you can make sure that you cover that area, or you get these ends of the Kinesiotape to really get that area. And if maybe another area is not really that affected or not as swollen, you don't need to put as much over there. Overall, you want to get most of the surface area, so you're going to spread out these lengths of the Kinesiotape and give them as much surface area as you can. So how do we want to put it? You want, again, make sure that you don't have any lotions or oils on, and make sure you get them off if you do. You want to start with the anchor, so the piece at the end. And we want that to be closest to where the fluid should be moving to. So if I have fluid in my arm, I want it to move up out of the arm. So my anchor, or my 1 inch area, is going to start on the top, and then the rest of the pieces are going to go downward. So what you can do is you're going to tear about where that inch area starts. I'm tearing each one individually to let go of that top. And then what you'll be able to do is peel off that first anchor paper, put that aside, and you want to make sure you don't touch the adhesive too much. But what you'll do is you'll place it on the skin, and then you're going to rub it in. So when you rub or you heat the Kinesiotape, that's what activates the adhesions or the glue to help keep it on. Okay, so then we're going to go ahead and start to go one by one down, and what I'm going to try to do is bring them across my arm and around. So I'll take the first one, you're going to peel it back, and I'm going to peel it back to about 1 inch left on the other end. We want an anchor on the other side, or it may lift up a little too soon. So when placing the Kinesiotape, we don't want to make it as tight as possible. We don't want to stretch as hard as you can. We want only about a 10 to 20% stretch. So if you're not really sure, go ahead and go 100 and then back off and get where 50, and then maybe figure out about where 10 or 20 is. It shouldn't have a whole lot of tension at all at this point. So what I'm going to do, because with one arm it's a little bit more difficult, so you're going to give just that slight little bit of tension, and then I'm going to wrap it around just make up whatever direction you want to go and lay it down. So that last piece I didn't pull off, I just peeled it off and laid it. So you have a little anchor at the end. And then what I'll go do is get that to go down. I'll come back and rub them all in. So the second one, same thing. Go till about there's 1 inch at the end, stop, I hold that back. And then I'm gonna follow a similar pattern, so just that 10-20%, and then make a little bit more of a loop. Place that down. Same thing with the third, 1 inch at the end, just a little bit of pull. And then last one, I may go a little, whoops, a little straighter down. I'm gonna fix that a little bit. There we go. And then I'll go back and I'll rub that in, make sure that the glue activates. So again, there's really not a specific place that you need to put the tape on, but I would recommend just trying to cover as much area as possible. So when I do the second piece, let's see what that is actually. There it goes. So second piece, I'm gonna actually start from the back and then I'm gonna wrap around towards the front. So pull off the top part for my anchor. And then I'm gonna put it back, just make a place up and put it on the back side of the arm. Rub that in. And then same thing. So you have someone to help you, it's probably a little easier, but not everyone does, so show you that it's doable. So I'm gonna take the front one, and the first one I'm gonna come across back to the front. Again, really light tension, if at all. That one's down. Second one. So as you can see, it looks a little crazy, but you're gonna have 1 anchor in the front, 1 anchor in the back, and you're just gonna try to wrap around and cover as much surface area as you can to give as much lift as you possibly can. If you feel like there's a lot of pull or a lot of tension, you may have pulled the Kinesiotape a little too tight, so you may wanna start over to make sure that it's comfortable. Okay, so the next part, I'm gonna do the forearm, and again, you could start with the forearm and then come back to the upper arm, that's fine. So same thing, we have the anchor. Peel that back. And I wanna do the same idea. I wanna put one on the top area and the bottom, or inside, outside, whatever works. But you do have lymph nodes around in the inside of your elbow, so I'm gonna go near that for one. And you can start above the crease if you like, you can start below. I try to pass as many of the joints as possible because I feel like sometimes that's where people get backed up and I want a little help. So I'm actually gonna go right above the elbow crease. So that's what it looks like. I have some crossing the shoulder joint, or the elbow joint, excuse me, and some not, but I'm gonna have it wrapped around and cover as much as possible. So that's the arm piece. Now again, the goal is to get the fluid to move up out of the arm, but if you've had lymph nodes removed or this area or these lymph nodes are affected and it was causing lymphedema, we want to also try to get the fluid moving to another area that may not be affected. So if you have secondary lymphedema and it's only affecting the one arm, we can move it across to the other arm. However, if you had lymph nodes or you have both arms affected, we may not want to do that. So you may think about getting the fluid to move down towards the groin area or the hip region instead. So to make it visual so you can see me, I'm going to put one across the chest. So same thing, we're trying to get the fluid to move across, and so my anchor is going to be closest to the area I'm trying to go towards. So the fluid can cross what we call anastomosis, which is right in the middle of the chest, as well as across the front at the belly button area. So if you're making it for the chest, we want it long enough that the anchor starts across the midline. You can go all the way across if you want. I'm going to start just a little bit closer to make it easier. But what you can also do if you're going to go down towards the hip or the inguinal or groin lymph nodes, then you want to make sure that this is long enough that the anchor is below where the belly button would be. So what we'll do, again, you can also put it across the back. You may need a little bit of assistance for that, so I won't be doing that for the video. So I have my anchor, then have the midline here. So I'm going to go just across the midline to here. Again, this tape is safe to be on for up to about 5 days. If it stays on, it may start to peel up like mine has already because I got stuck on it. But then what I would do is just try to trim that edge so the rest of it doesn't peel up with it. When removing Kinesiotape, again, you want to put either baby oil or lotion or extra water or something to moisturize the tape a little bit more so that you're not peeling off harsh tape. What you want to make sure you do is you're not pulling away or pulling the skin. You rather want to lift up and then push your skin down in a way so you have control of your skin rather than just ripping back like that. Especially if you have thin or sensitive skin, you're going to cause irritation to the area. So be careful when you take off the tape. So now I'm going to go ahead and take all this off and we'll come back and talk about the leg. Okay, so now we're going to go through how I would apply the Kinesiotape to a leg for someone who has lymphedema in the leg. Now, again, if you have secondary lymphedema due to gynecological cancer or for another reason, and maybe you had lymph nodes only removed from one side, then it is safe for you to try to get the fluid to move towards the other side as well as trying to get the fluid moving towards the top. If you perhaps had lymph nodes taken out from both sides, then you would not want to help move this fluid that may be congested to a leg that maybe doesn't have lymphedema, however, is at risk for lymphedema. So stay away from crossing midline if both sides are affected. If you have primary lymphedema and you do have affected limbs on both sides, then you just want to start to draw it upwards towards the abdominal area or another area that maybe is not as congested. So what we want to do is we want to do the same thing. We want to make lengths of Kinesiotape for the upper thigh, for the lower leg, and also the foot and ankle. So after you have your leg pieces cut, then you want to either cut a trunk piece or a piece across. Again, you don't have to do that. All of these pieces do not need to be used completely together. You can use one piece at a time. So if you're wearing a thigh-high compression garment and you just want to get some congestion out of a little bit of the groin area, then maybe you just do the piece up the side of the trunk or across. As well as maybe you have a knee-high garment on and you just want a little bit moving out of the knee or the thigh, then you can wear your knee-high garment and then maybe put the Kinesiotape for the thigh to help get it moving out a little bit further. So I'm going to go ahead and cut all of my pieces for my leg. Okay, And now that I have all of the edges rounded on one side, I'm gonna go to the side without the edges, and same thing, cut it into 4 pieces, making sure that I leave about 1 inch or 1.5 inches at the end. Okay, so I have all my pieces cut. I have the edge curved on the anchor side as well as the edges curved on the single pieces on the other end. I'm gonna start at the foot and ankle to help draw up the foot from distal to proximal. So what I'm gonna do is same thing as I did for the upper extremity. I'm gonna put 1 more on the inside and 1 more on the outside of the ankle, crossing that ankle joint down into the foot. Now you may have gotten that a little bit higher under the clothing around where the groin area is, or even across that hip joint, but just so you can see me, I put a little lower. Again, it is not wrong to do lower, it's just ideal to get up towards where those lymph nodes are sitting. So again, the last piece, if you are wearing compression garments for your leg and your lower leg and you just want to get something moving out of this area, you can take this strip, and what I would do is find where the belly button is and make sure that it starts above that. Or if you're trying to get it across to the other lymph nodes on the other groin area, then make sure it crosses the belly button from the midline. So starting low, but over here, and bringing it across. Again, key points is to make sure that you only have about 10 to 20% tension when you're pulling. You can make any pattern you want, trying to get as much surface area as possible. That's why we weave over across each other. It is not wrong just to use one strip and just place it in an area that has stubborn swelling. You can use as much as you want, but we use it as conjunction right now for compression garments to get out of the garments for those who have pain with their garments or can't tolerate them, or also for those who have a thigh high but possibly are still having swelling a little bit higher or in the genital region. We'll use this to try to get the fluid moving up into the abdomen a little bit deeper to the deep lymph nodes, or up to the sides to the axillary or armpit lymph nodes if these are not affected as well. Make sure you follow up with your CLT or Certified Lymphedema Therapist so you can rule out any concerns or precautions that we may have before using Kinesiotape. Just know that although there's not a whole lot of research that compression garments may be still a better option than Kinesiotape, that it is an option for those who have swelling in an area that you can't compress as well, such as genital lymphedema, trunk lymphedema, chest wall lymphedema, or even head and neck lymphedema. Kinesiotape can be a wonderful tool for those with lymphedema who need another way to manage their symptoms. Feel free to give it a try, and comment below if you have any other tips or techniques that worked well for you. Thanks, guys.